Hello everyone. In our previous tutorial, the focus was on metrics in medical affairs, both the qualitative and quantitative metrics. We discussed what can be measured, why measurement is important, and how metrics help to demonstrate the impact and value and credibility of medical affairs. We also discussed the importance of communicating our metrics of different medical initiatives and when exactly to do that. Today, we will talk about the bigger picture, setting SMART goals in medical affairs, while still using those metrics to measure the achievement of each goal. And we will use probably 4 practical examples in order to show everyone what good looks like in the eyes of the leader or the manager, and how to build our goals so no one would ask us later what was the impact. This is important because in medical affairs we do most of the important work. We generate and collect data, report numbers and insights, and we build long-term partnerships and relationships. And if we are not very clear on how to set our goals appropriately, we won't be clear also on what actually we are trying to achieve. So in this session, we will focus on turning a strategy into goals and the goals into metrics. Talking about SMART objectives, the word SMART refers to the structured way of setting goals that are specific, measurable, achievable, relevant, and time-bound. It ensures that objectives in medical affairs are clear, realistic, strategically aligned, and measurable from the very beginning. I have always preferred my teams to use as a guiding framework when they set their goals, for 4 simple reasons. 1, SMART goals bring clarity to the work that is often complex or multidimensional and difficult to define upfront. In medical affairs, many activities are very scientific, long-term, and outcome-driven rather than transactional. And without structure, teams may be active and well-intentioned, yet they will struggle to demonstrate the focus on the alignment and impact. Using SMART goals, and this is the second reason why they are good for us in medical affairs, forces an important shift in thinking. It moves the conversation from what we are doing to why we are doing it and what success actually looks like. When objectives are specific and measurable, we can prioritize better, make stronger decisions in the field, and avoid spreading effort across too many initiatives with limited strategic value. The third reason is consistency. SMART goals create a shared language across medical affairs. Whether the discussion is with the field teams or with the medical leadership or across functional partners, everyone understands the objective, the expected outcome, and the time frame. This reduces misalignment, unnecessary rework, and last-minute pressure to justify activities. The fourth, and I think the most important reason, is that SMART goals connect strategy to metrics in a natural way. When goals are well defined, the right qualitative and quantitative metrics become obvious and easy. Measurement stops being an afterthought or a reporting exercise and becomes a tool to learn, to adjust, and a tool for continuous improvement. For these 4 reasons, SMART goals are not about control or limitation. They are about enabling us to work with clarity, confidence, and purpose, while maintaining scientific integrity and compliance, of course. Let's have our first example for turning a strategy into a SMART goal with the respective qualitative and quantitative metrics. Let's say that we have the strategy to increase the professional awareness about new data in diabetes and blood sugar control. We can say here, given this strategy, that the SMART goal is to increase professional awareness and understanding of newly published data on diabetes and blood sugar control among priority healthcare professionals by delivering structured scientific education activities over the next 6 months. Then the metrics will come. Quantitative, a total of 12 face-to-face educational activities plus 6 webinars. And then the qualitative, like at least 5 of the sessions will be assessed using a standardized post-interaction rating scale. Let's take another example, and this time about generating medical insights. And if we assume that the strategy is to generate medical insights about heart failure patient journey, we can say that in this strategy, the SMART goal can be to generate high-quality actionable medical insights on the heart failure patient journey by conducting structured scientific engagements, the key opinion leader engagements, including at least one advisory board with priority healthcare professionals over the next 3 months. Then the metric will come. Quantitative, say the number of the engagements that you will do in the first quarter, for example, at least 20 scientific engagements covering the priority customers. Key stages of heart disease will be covered during these engagements, including a minimum of 1 advisory board to be conducted. And for the qualitative, you can again refer to a post-interaction survey. At least 10 of the engagements, including the advisory board, will be assessed using a standardized insight quality survey to evaluate the depth, relevance, and accountability. Let's move to another example, this time about data generation. If we have a strategy to generate real-world data to better characterize cardiovascular risk factors among adult smokers, for example, we can say that the SMART goal is to generate real-world data to characterize cardiovascular risk factors among adult smokers by initiating a supporting structured real-world evidence initiative over the next 12 months. Then the metrics will be quantitative activation of at least 2 real-world data sources such as registries, electronic health records, or observational cohorts, and inclusion of a predefined number of eligible adult smokers in the real-world data set. The qualitative will be the data quality and consistency will be assessed through the predefined data validation checks, and you can include here regular audits on the conduct of the registry and the data. Another example, when we set goals for advisory boards, and let's say that we wanted to generate expert scientific opinion about an introduction of a new vaccine. The goal here will be to generate expert scientific input and insights on the clinical value, implementation, and considerations of unmet needs related to and the therapeutic area. So we will conduct an advisory board with priority healthcare professionals within the next 6 months. Then the metrics will come. 1 advisory board conducted with participation of at least 10 priority healthcare professionals representing the relevant specialties and the practice settings. So this is the numerical or the quantitative metric. The qualitative is a little bit tricky. The advisory board outcomes will be assessed using a standardized post-advisory board evaluation to document the quality of the discussion, clarity of recommendations, and relevance of insights to future medical strategy. I would also include here some action items based on the insights collected. How many actions were taken after the advisory board? So these are 4 examples, and if you have noticed that for all the previous ones, the previous examples, we kept using scales and surveys to assess the quality of each initiative. And this is the most common and easiest way when it comes to qualitative metrics. And as we discussed in our previous session, the art here and the skills lie in the questions you include in these surveys and scales before even the initiative starts. So, ladies and gentlemen, this was a short session aiming only to demonstrate how to turn a strategy into a SMART goal with both types of metrics. Please let me know if you have any question. Thanks, and see you next time.